Today we are discussing something no parent ever wants to face. Prescription drug abuse among children in our community continues to grow at an alarming rate. In fact, it is a national epidemic according to the Centers for Disease Control and Prevention. Because of that, we have developed a 4-part series covering just a slice of what is happening in and around Mission Viejo. In the second part, we will explore the depths of addiction in our own backyards.
I'm an addict, and an addict to me is not drugs and alcohol. Drugs and alcohol are a symptom of the problem. Drugs or alcohol are what I use to quiet my mind. My problem is me. I'm an addict. You take away the drugs and alcohol, I'm left with myself, and that's why I use the drugs and alcohol. So a lot of people think that they can just take away the drugs and alcohol, but the person that chose to use them in the first place, the person that's using them to escape reality, is still there. So you have to take away the drugs and alcohol, you have to fix the underlying issue, or you're not going to stay clean. You might white knuckle it, you might just, I just don't use drugs anymore. Find out why you use drugs in the first place. Get to the root issue and solve that, so there's no chance of it coming back up. And that's what I've had to do to stay clean. I wasn't a happy child. I really wasn't. I was very angry and withdrawn, and like I said, wanting to know why things were the way that they were. And I'd go to school and you see all these happy parents and kids, and I'm like, why are you so happy? I don't understand what's there to be happy about, because all I knew was the fighting, and a lot of people in my family use drugs and alcohol. So that's all I knew.
Their dad and I got divorced when they were quite a bit younger. I think Brandon was 12, Andrew was 9, and Nick was just turning 6. There was a lot going on with that. A lot of addiction issues in both our families. On their father's side, they have their father and their grandfather, and on my side, they have my father. And so addiction ran in the family. But I wasn't as educated then as I am now. So I didn't really realize how having that addiction on both sides of the family could be so powerful.
If every day is to wake up and to struggle to put a smile on my face, to live like this lying to myself, because I wasn't happy. And for the longest time, I didn't know what it was like to be happy.
Apparently he started at the age of maybe 11. But it got more heavy around the age of 14. And at first I was kind of like, my thought was, oh, well, thank God it's only pot. But what I didn't know then that I know now is that the marijuana that we had in the 80s is nothing like what these kids have now. I mean, back then we could say, yeah, oh, it's natural, it grows in the ground. There's nothing natural about what these kids are smoking today. It is so chemically enhanced. And so now I know that saying, oh, well, thank God it's only pot, was probably, if I had a different mindset then, I may have been able to jump in and intervene and take it a little more seriously than I did. But by the age of 15 and a half, Andrew was already in his first rehab.
For the most part, when I first started getting high, I enjoyed it. But I don't think there is such a thing as a functioning addict, or if you're using drugs to escape a problem that's not healthy, and there's people out there that they can drink socially, and they can, there's people that smoke pot socially, and they do all that stuff. And, my hat's off to those people. I commend them for that, but my head just doesn't work that way.
I think somewhere right around the age of 16, it escalated from pot to cocaine. And to be honest, Andrew's very open and honest about his drug use, and so if he were sitting here, he would literally have the timeline for you. I mean, he would know exactly when he did everything. I didn't know, because Andrew was very, very good at hiding it.
I smoked pot the first time I was 13, you know, and at 12, 13 years old, and then it's pretty much spiraled out of control since then. I did it just for fun the first couple of times, but after about maybe 6 months to a year, it became on a daily basis, smoking pot. I'd smoke pot before school, you know, at school, after school, until I went to sleep at night. And when I woke up in the morning, it's the first thing I did.
And some of the things that started happening, well, you know, you see Andrew on a daily basis, so you don't notice the weight loss. You don't notice the change in color in his face. You don't notice that he's taken on this gray hue. And, you know, I noticed that he's spending a lot of time in his room, but, you know, oh, I'm just tired. I worked out too hard, those kinds of things. Then I start noticing other things. The spoons are all missing from the kitchen. All of a sudden, I'm going through roll after roll of aluminum foil. Prior to that, it was water bottles are going missing all the time. Green apples are going missing all the time. And I'm thinking, wow, all of a sudden my boys have a thing for green apples. Well, then all of a sudden I'm walking down the side yard one day of the house doing some cleanup, and I see stuff sitting on the ground there, and it's green apples, it's water bottles, and they've turned them into homemade bongs. And they're smoking pot or whatever else they're smoking, and they're doing it out of the apples and out of the water bottles. But the biggest eye-opener for me was all of a sudden finding these little pieces of what looked like a water balloon. And I'm starting to see them around the house. And I'm also starting to see Andrew with black soot on his face. And I'd ask him, where did that come from? And he'd say, oh, that's from my bike, because he rode a motorcycle. And he also has a dirt bike, and he'd always work on those. Oh, that's grease from, and he'd wipe it off really, really quickly. Well, I didn't know then what I know now. I didn't know that those were signs that my son was smoking heroin. Because Andrew had already lost 4 or 5 friends to heroin, and so he would always say, oh God, that's something I will never ever try, Mom. And of course, you believe it because you want to believe it. You want so badly to believe it. We're talking on the phone, and I'm expecting him to tell me he's addicted to cocaine or he's addicted to methamphetamine. Not that those are any better, but of course there's such a stigma with heroin. And so when I called him and I said, okay, so what's going on with you? Is it pot? Is it cocaine? And he's like, no. And I'm like, well, why do you say it like that? And he says, I thought you knew. And I said, no. And he said, Mom, I'm addicted to heroin. And not that the other drugs aren't bad, but the bottom just fell out of my world. And I started hyperventilating, and my husband Dave was driving, and he had to pull over because he had to calm me down. And it does carry such a stigma. And you know, a lot of parents will say, oh, my child has a problem with this, or my child uses it recreationally. But people really do look at you differently when you say my son's a heroin addict.
I'm a heroin addict, you know, and heroin has taken me to some pretty dark places in my life. Starting off smoking pot socially with friends, to reaching a point to where I'm locking myself in a bathroom and injecting heroin 6 times a day, you know, and it's a dark place. It's a dark place to be in. You know, the last time I was out there using, I was using heroin, methamphetamine, drinking, smoking weed, and eating a lot of benzodiazepines, Xanax, Valium, Klonopin. I mean, my day usually consisted of waking up to a shot of meth and heroin in the same syringe. And then I'd smoke a joint, drink a beer, and eat a couple Xanax.
It just kind of escalated from there. He's been in UCI neuropsychiatric youth care twice. He's been to Chapman. He's been to an outpatient program called Breakaway. He's been through medical detox 4 times. He's been to Hope House, and he will be going back to Hope House probably next week.
I went into recovery because I was sick and tired of the way I was living, and I was arrested in the hospital in drug-induced psychosis. You know, when I was arrested, I was about 130, 135 pounds. I was, you know, as white as a ghost. I had open sores all over my face and arms. And I was running through Whiting Ranch Wilderness Park from people that weren't there. I was full-blown psychosis, hallucinating, and it wasn't fun. It was miserable. Being in jail while kicking heroin, you know, with my family wanting nothing to do with me, because you can keep telling everybody you want to get clean, but that only works so many times. It reaches a point to where your word means nothing. You know, you can talk the talk, but if your actions prove otherwise, people catch on to that eventually. So I stopped telling everybody that I'm gonna get clean. I'm gonna stop using drugs, because I wasn't done. I wasn't done getting high.
You know, through all of this, there's three choices, or there's three outcomes rather. There's jail, there's death, and there's recovery.
I say this now that I spent so many years searching for happiness that when I stopped looking for it, I realized it was already there.
The night that we did night number 2 of the drug education series, and we're sitting there, and Commissioner Hall was speaking, and Andrew was sitting next to me, and he was starting to get very agitated. And I was like, what's going on? What's up? And he's like, I need to step out and use the phone. And so I was like, okay, well, make it quick. So he stepped out and he used the phone, and he comes back in, and I could tell something was wrong. And he had gotten a phone call from the Hope House, which is where he was in treatment. He had been there almost 6 months. And he came back in, and I said, what's up? And he said, 4 plainclothes were at the Hope House looking for me. And I said, for what? And he's like, I don't know. They didn't tell anybody why they were there. They just left their card. So I said, okay. So we sat there, we talked about it a little bit, and I said, well, you need to push it out of your mind for right now. And he's like, no, I know. So he did. He pushed it out of his mind, and he got up and he spoke. And it was like he pushed it out of his mind and into mine. Because then I sat there thinking, oh gosh, what are they, you know, I thought everything was behind us. And so I sat there worrying and whatnot. And so he spoke and, you know, talked with a lot of people afterwards and everything else. And so we headed back to the Hope House because he had his curfew. And the whole way back he was very agitated. He was making phone calls to other people at the Hope House that had phone privileges, because most people there don't have phone privileges. You have to earn that. And so we got back, he went in, the police were gone, and they had left a card. So the next day he called, and it was Friday, and the whole team was off for the weekend.
Life's gonna throw you curveballs. I've learned that the hard way. I tried to call him, I couldn't get a hold of him, so I waited till the following Monday.
So could he spare some time in the next few days to come in and answer some questions? So we're thinking, okay, no big deal. But he wanted to get it out of the way. So I took him that Monday to the sheriff's substation in Mission Viejo, and went in, and deputies came out, plainclothes came out, talked with him, took him in the back room. I was sitting there reading a book, waiting, and it seemed like forever, but it was really less than 10 minutes. And then he came out, and he was holding all of Andrew's stuff. And I thought, oh no. So I said, what happened? And he said, well, your son's being placed under arrest. And I said, for what? And they said, residential burglary. I said, it's not possible. I said, my son was in jail, picked up from jail, from the Hope House, taken to the Hope House, where he's been for almost 6 months. And he says, this happened 8 months ago. So before Andrew went to jail, when he was out on the street, because I wouldn't let him live here while he was using, he allegedly committed a residential burglary. And that's what he's back in jail for now. So 5 days short of his graduation date from the Hope House, he ended up back in jail.
They had my DNA that was left in a house in Mission Viejo, and I was charged with residential burglary. and I have a prior strike for residential burglary. So residential burglary is it's a heavy charge. Unfortunately, the past caught up with me, and now I'm facing some pretty heavy consequences if I go back to using.
Yeah, he will be going back to the Hope House as part of a plea agreement. He spent 6 months, well, 5 days shy of 6 months in 2012, early 2013. Got rearrested on an 8-month-old burglary charge and ended up back in jail. This is Andrew's second strike.
That's the least of my worries. I mean, it's definitely up there. It's a lot of time. You know, I signed a 17-year suspended sentence. The life that I have versus what I used to have, I'm not willing to throw that away for anything. I'm not in my right mind when I'm under the influence, and I made a very stupid decision, and now I have to pay the consequences for it. That I'm sorry. I'm truly sorry for what I did. You know, if I could take it back, you know, I definitely would. You know, I realize that somebody's home, that's their safe haven. That's where they go after work to be with their family, and to have somebody, you know, violate that living space and to steal, you know, jewelry and you know, their possessions. I can only imagine how that feels. And if I could go get the stuff back and bring it, I mean, I would. But unfortunately, you know, I can't do that. I have to face what I did and pay the consequences for it. You know, I can't apologize enough.
Having to drive to Theo Lacey every Friday to visit him, it's horrible. It's horrible to have to look at your child through that glass and talk to them on a phone, you know, and have the phone cut out right when you're in the middle of a conversation and the line just goes dead, which of course every time it happens I still jump, and Andrew still laughs at me. He's like, how can you not know it's coming? You're always looking at your watch. You have a stopwatch on. How can you not know it's coming?
In my right mind, I would never have done something like that. You know, I have morals, I have values. You know, I went to good schools down there, you know, and unfortunately when I'm under the influence, all that stuff just flies out the window. If you're, I want to say, like, to people out there, you know, if you're struggling, if you need help, ask. The help is there. You know, you don't have to go through all that pain. You know, there's people out there, you know, so don't be afraid to ask for help. It's important. Don't be afraid to talk to your parents, you know, just ask for help. That's important.
Andrew, in my opinion, has the ability to make a difference. He wants to become a drug and alcohol counselor. He wants to go out into the community and in, you know, wherever it's needed, and try to educate the kids and educate the parents, and hope to help even just one family avoid what he's been through and what he's put me through.
The misery that I experienced from drugs and alcohol, I wouldn't wish drug addiction on my worst enemy.
Andrew is an addict. He will always be an addict. Whether he's a using addict or an addict in recovery, that's the choice he has to make. Right now, he's choosing to be clean, and he's choosing to stay off the drugs, and he does have 11 months clean. And as I mentioned previously, he will go back to the Hope House for 3 months, and then he will do intensive outpatient, individual, group counseling, as well as Narcotics Anonymous meetings. He'll have to check in with the court weekly. It'll be a big deal for him, and he'll do that for 18 months. But the alternative was serious jail time.
You know, I'm grateful for the Hope House. it gave me the opportunity, like I said, you take away the drugs and alcohol and I'm still left with myself. That's what we focus on, you know, that's what the program focuses on, is the underlying issue behind the drugs and alcohol.
Some of the things that you've written, Diana, are just absolutely beautiful. I mean, that reflective nature that you have, where you are able to get down deep in that. If you could just share a little bit about that, of some of the things that you have thought about and really contemplated and thought through, that they're just powerful.
Well, I would say the one that comes to my mind first is hope over shame, which is one of the things I have written. And what I talk mostly about in that is how when I started out writing it, I think the opening paragraph is, oh God, I hope how people don't see my secret. Because they'll, you know, it's shame. You know, until I got educated, I was ashamed of the fact that my son was a drug addict. Very, very ashamed. Now that I understand the addiction, I understand that they are so powerless. It's changed things for me. And so I have replaced the shame with hope. Hope that my son will make the good choice every single day of his life to get up and stay clean. And in there I also say that I wish that the only choice my son had to make every day was which pair of pants to put on. You know, I wish that was his biggest decision and his biggest reflection for himself. But every day he's got to get up and he's got to make that choice to not use drugs.
Recovery for me is a lifestyle. You know, drug addiction is a lifestyle. Recovery, I have to. There's a saying that if you put the effort into your recovery that you put into your using, you've got at least half a chance. You know, the lengths that I was willing to go to stay high, I mean, I stopped at nothing to stay high. So if I put half that effort into staying clean, I have at least half a shot.
I try to be hopeful, you know, that he will make that choice every day. I try to be hopeful that we'll continue walking on healthy paths at the same time. I do consider myself to be on a healthy path now. I don't consider myself to be a codependent anymore. I don't sit there and stare at the telephone waiting for it to ring. I don't, when he's not in jail, I don't sit there and text him and call him and drive him all over town and do those things, because I have to put that aside and let Andrew make those choices. Because if I make those choices for him, he's really not staying clean for the right reasons. He's staying clean for me. Andrew has to want to be clean. And I've been through all of the codependent stuff. I mean, sitting there every time the phone rings and jump. Oh my God, is this going to be the police telling me that he's been arrested? Is this going to be the coroner telling me that my son is dead? What is this, you know? When the phone rings after 10 o'clock at night, it's usually not good news. No. Or a knock at the door when you're not expecting somebody, or especially in the middle of the night. And I've had that. I've had the sheriff here looking for him to, you know, enforce a warrant. And that happened once, and it was the middle of the day. And Andrew was actually in a drug treatment facility at the time. So I was able to say, well, my son's in rehab. This is where he's at if you want to go check on him. And they said, no, we're going to leave him there. If that's where he's at, that's where he should be. I think the other one I've written is my son's addiction equals my pain. Because it is painful as the parent of an addict, because you are powerless. And that's a foreign concept to a parent, because you have your children, they're babies, you raise them, and you know, you're in control, you're in charge, you know, they act up, you ground them, you know, you have control. But when the drug addiction creeps in, there's no control left. And that is, especially for me, because I do have a little bit of a type A personality. And I tell Andrew this all the time, I just want to shake him. I want to grab him and shake him until it's gone. And I know that's not possible. And so it's frustrating. So at some point tough love has to come in. And you have to realize, especially if you have other children in the household, you have to protect them. The addict has made their choice to walk that path. I firmly believe that when an addict first starts using, they have a choice that first time or even that second time. But those that are truly addicts, once they have used once or even twice, their choices are gone. The addiction has taken over. And so then it becomes my responsibility as a parent to protect the other children.
I love my mom to death. My mom was my best friend growing up. You know, my mom has been there for me no matter what. You know, my mom's shown me tough love, some pretty harsh tough love, and I thank her for it, because everything that she did and everything I went through led me to where I am today.
Just looking at my child and seeing what he had resorted to. I mean, seeing him in jail is hard, but seeing your child homeless is devastating. But I also knew he couldn't live here because I was just perpetuating the cycle. I was continuing to put a roof over his head, food on the table for him, and he wasn't gonna hit rock bottom that way. And without hitting rock bottom, Andrew wasn't gonna change. I would give my life for my children, any one of them. I would give my life for them. But I won't give my life to his addiction. I absolutely will no longer give my life to his addiction.
And there's the distinction, isn't it?
Big time.
Yeah.
Yeah, absolutely. Absolutely. It's not, you know, I say I hate the addict, but I adore my son. And they are two completely separate people. Yeah. I've called the police on him multiple times. I've had him arrested. I've had him taken from Mission Hospital to jail. And he walks to the police car yelling and screaming at me about how I ruined his life and he hates me. And 2 days later, when the drugs are out of his system and he's starting to go through withdrawal, he's calling me and saying, "Thank you so much for saving my life again."
I may not have, you know, this high-paying job. I may not have, you know, a car at the moment. I may not have a bunch of material possessions, but I'm happy, I'm clean, and I have a family that loves me. You know, what more can I ask for?
Andrew knows the difference between right and wrong, and Andrew does have good moral values, but when the addiction creeps in, Andrew's only care in the world is getting high. And so everything I taught him goes out the window while he tries to get his next fix, and especially when he's out on the street.
I did a lot of really terrible things in my addiction. I stole from my family. I lied. You know, I stole a lot of money from a lot of people. And, all I'm trying to do now is apologize for it, because I can't, you know, I have nothing, I can't pay it back. You know, when that time comes, you know, I'll address that issue, but I just want people to know that I'm sorry for everything that I've done in my addiction, and that I can't take it back, but I plan to make a point to, you know, to be a different person in the future.
I think what I would say, and my younger son Nick and we were talking earlier this afternoon, and I think he said it probably best as well, and that is, be involved in your children's lives and don't be your child's friend. They have enough friends. They don't need another one. They need a parent. They need you to be actively involved in their lives as a parent. And so when I hear about these parents that are letting their kids have parties at their house because it's safer than them being out on the street, you're not doing your kids any favors. You're really not, and you're not doing anybody else's kids any favors. And Andrew also has, you know, he says, let the spaghetti burn. He's like, it's only a pot of spaghetti, but if your kid wants to talk to you, turn off the dinner and sit down and talk to them. Don't let that moment go. And if your child is courageous enough to bring up drugs with you, don't shy away from that subject. You have to embrace it. And if your child doesn't bring up drugs with you, then you need to bring it up with them. But first you do need to educate yourself. And there's a wealth of information on the internet. Partnership for a Drug-Free America is probably one of the best places. They have 7-minute video clips on every one of the street drugs that are out there, what the symptoms of use are, what the possible outcome is, you know, whether they can overdose from it or not overdose from it. And those are things that parents need to know, because if your kid asks you, you need to be able to answer it. Right. And if you don't know the answer, find it together. Don't make something up. Go and find the answer together.
I'm no longer going to run from my problems. And a lot of people think that, oh, I don't use that much, my problem's not as bad. What I had to say to them is not yet. It gets worse. You know, it's maybe not right away, but it does get worse. You know, it's a miserable way to live.
What are the trends that you have been seeing in terms of age, demographics, and the types of drugs? Just to give you some idea.
By way of background, I did primarily criminal defense as a practicing attorney for almost 30 years. I've been a commissioner for 3 years before I came to this assignment. Early in my career, heroin use was prevalent, and there were a number of cases that involved people under the influence of heroin or possession of heroin. Then it seemed like cocaine became more available. And then after that, probably 25 years ago, methamphetamine, because of the low cost and ease with which it can be produced, became very prevalent, and was also a low-cost thing. So I was shocked when I came to this assignment 3 years ago, and I'm looking through every morning. I start looking through the cases that are here for the first time. So those are here for what we call monitoring review, and I start going through those cases. I see 2 or 3, maybe 4 young people, 18 to 22, 23 years of age, who are charged with possession of heroin. Now, there may be some others that have been charged with possession of methamphetamine, a few with possession of cocaine, some perhaps with possession of prescription pills. But I'm seeing these heroin cases, and so I have some discussions with there's a probation officer who's assigned to my court, a public defender, at least 2 public defenders, and a deputy district attorney. And so we sit down and have a little discussion about, hey, where did this come from? Because I hadn't seen this trend before. So they said, no, this has been a trend that we've been seeing here. Those people from probation, as well as the public defender and the district attorney. So I said, well, can we figure out where this is coming from? And they said, well, let's try. So with their concurrence, I was allowed to speak with some of the people that were coming through this court that were in that age group to say, okay, how did this all start? And you're not going to be in any trouble for saying this. It's not going to be used against you in any way. It's basically to help us understand what the issue is. Invariably, the story would be at age 11, 12, 13, 14, start drinking alcohol, maybe taking some alcohol out of the family alcohol cabinet or whatever, or drinking with friends, perhaps then smoking marijuana, and perhaps then moving to a point where somebody says, you know what, if you take some of the pills that are available in the medicine cabinet, for example, Dad went to the dentist 2 years ago and he's had a Vicodin prescription, and there's a few Vicodins still left up there. You know, well, I'll take those. Dad'll never miss those. He hadn't missed them for the last 2 or 3 years. Perhaps it's someone else in the house's pills, and whether or not there's 25 left in the bottle or 24, who's going to count? Who's going to know? And so the people, young folks, would have parties called farm parties. And the farm parties require you to bring as your entrance fee some prescription drugs, Vicodin, Oxycontin, hydrocodone, those types of things, Xanax, Soma, etc. So they go to the party. There's a bowl at the party, as I'm told. They put the pills in the bowl, and during the party you're expected to take some of those pills and have them, and you'll have an effect. Of course it's going to have an effect on the body, and also they don't know what they're taking. Many of these pills are opiate-based, so that means that they're basically getting addicted to the substance that's in the pills. Now, when they can no longer get the pills, perhaps they steal, take something from the family house and have it disappear, take $10 from somebody's wallet, who knows, and buy the pills. Now, the pills, somebody says, you know, those pills are really expensive. It's cheaper if you get this stuff called heroin. And if you smoke the heroin, some people have been told you're really not a drug addict if you smoke it, you know. And so they believe it, and it is, according to what the police investigators tell us, it is cheaper in small quantities than the pills out there. So now they're smoking heroin and even moving to injecting it, because eventually when you have the addiction, you want more and more and more to crave the addiction. And some of them go to mainline use of the drugs. The trend, the more I've researched it, the more I've seen people here in court, is along the lines I've indicated. Everything that comes out of the federal government and all of the federal policy organizations for drug abuse mirror that this is a nationwide epidemic involving prescription pill abuse, and that it often leads to heroin abuse or some other abuse. Another issue is, I think, the fact that at that age, middle school age, high school age, people are more risk takers than others. And the risk taking doesn't necessarily have to exist with regard to drugs. I think there's, I shouldn't say everybody, but I'll admit to it that, you know, you've taken some risks at a certain point in time in your life, and then you look back and you say, wow, did I really do that, or did I survive that, etc. So there's this, and the experts tell us, and I'm not an expert in anatomy and physiology or the development of the brain, but I've been to some seminars about this issue, and we used to think that the brain was developed by a certain age, etc., and now the experts tell us, you know what, it's really not fully developed until you're in perhaps your early or mid-20s.
Explains a lot, doesn't it?
Well, excuse me, if you start using drugs at age 11, 12, or 13, what have you done to that development that's supposed to have occurred by that period of time? So, you know, it's the risk-taking, it's the peer pressure, it's the wanting to fit in. You have an amount in certain areas of the county. You have wealth. You have the fact that there may be parents that have, each parent is working, and so there's not home supervision. You have, due to budgetary cutbacks, the lack of after-school programs or activities, or a cutback on those programs, or some of those programs might involve fees, and some families can't afford those fees for the programs. So I think you have a whole number of issues. People just want to fit in. They don't want to be different, and that contributes to it. And you know, it's hard to say no when you're seeing your friends do it or your girlfriend do it, and they're saying, "Come on, you do it. Come on, what's the matter with you?" People who have lived this and are living it right now have told us how they started. And if they've told us how they started, okay, then I think we need to do something that stops them from being involved in it. And from that standpoint, I think we need to learn, and we need to listen to the people who are suffering from this. You know, you might have other people who say, you know, I've smoked marijuana for 40 years or whatever, and it hasn't been a problem for me, and I think everybody should smoke it. Fine, great and dandy. It hasn't been a problem for you. You made this transition to the prescription drug overdose. You haven't gotten involved with heroin. Great, that you could have avoided that. But how about this 19-year-old who shoots himself in the head, you know, because he's wigged out on drugs? Or how about have that tragic situation in Orange County that led to the Good Samaritan law, where you have the kids all under the influence and they dump their friend along the side of the road on a no dumping sign. And yes, people are looking around and say, well, gee, that's not my school, that's not my neighborhood, etc. It's Orange County, folks.
Tell us a little bit about the young woman that was here today from Mission Viejo. And that was a surprise to all of us that we had somebody here from Mission Viejo. Maybe you could tell us a little bit about her story.
Well, I have been impressed with her participation in this program for well over a year. I was very pleased when she was eligible for the dismissal of the charges, and it came up about a month ago. And so I thought, well, wow. I spoke with her once I granted the dismissal, and at that point in time, I didn't know that she had the new baby. So when she came into the well to speak with me with her lawyer, her mother came up and brought the baby cradle, you know, and I said, well, who's this? So I got to meet her baby, and she talked about the baby. And I said, you know, would you like to come back and participate in the future? She said, yes, I will. You know, there's no hesitation about it. And she felt very strongly that other people should learn from what she had been through and the mistakes that she had made.
You know, I was in 8th grade, started smoking weed. It was just a fun thing, you know. It's fun, hanging out with your friends. Simple. You're with your best friend and you get high and you laugh a little bit. To an 8th grader, it's very innocent. It's nothing. But from there, throughout high school, I started to experiment, do other drugs, ecstasy, heroin, whatever. But when I found my drug of choice would be heroin, I was 17 years old. I was a senior, you know, was becoming what I considered an adult, and realized that I had other stuff going on in my life. So I wanted to feel numb, and that's what heroin did. So that's when I found my drug of choice was senior year.
It starts from the prescription drugs, and we know we have this, what has been termed as an epidemic throughout the country, and in particular in Orange County we're seeing this through the reported deaths that we've been seeing from opiate use, which would include the prescription drugs. But what's happening is it is evolving from that. That's how it starts, and it goes into the heroin, and then of course the heroin could be mixed with other chemicals. You don't know what you're getting when you buy it, and it becomes very, very dangerous.
In order to support my heroin addiction, I had to steal. And I got caught stealing, which is what brought me to jail for the first time, which put me on probation, which led to all my other arrests because I was on probation. So I got searched, and that's where they found all my drugs, and that's where I got my possessions and my paraphernalias and stuff like that.
I've been doing this, like I said, for over 20 years. All of us have plenty of clients, young people who have drug or drug-related cases. Not only drug possession cases, but also drug sales. Most theft-related cases, or most theft cases are drug-related, and so you go into that whole area of burglaries, petty thefts, residential burglaries, smashing car windows to take property out so the property can be fenced. So it's just something you deal with a lot. You not only have to deal with their drug issue, but you also have to deal with their personal issues because they got the drug issue somehow from whatever they're dealing with. And a lot of times it's, you know, maybe they have anxiety issues, maybe they have depression issues, maybe they have problems at home, maybe they have problems at school. And you get a chance to talk to the young people, you also talk to their parents, and get a perspective on both. And I think over the years, the drug problem has become much worse.
I would give the advice of what my parents did. My parents kicked me out. They made me suffer. They didn't give me money. They never gave me anything while I was on drugs. They only helped me when I was sober. They only helped me when I said I was going to get sober. You know, they did the tough thing of having to let me go and kind of watch me suffer. And I think that in the end, it made me grow up because I didn't have my parents helping me anymore. I didn't have a house to live in. I didn't have anything to steal. I didn't have any money. I had to do it all by myself. And that's what helped me realize that, you know, I needed to get sober, that it was me who had to help myself and make that decision.
I'm father of two, and so I've dealt with, you know, my own kids, their friends, friends of friends. And really it comes down, I think, to parent accountability. There are a lot of reasons that kids do drugs. Some is because they haven't been given maybe the love, the attention, the supervision as they're growing up. A lot of times, especially in counties like Orange County, Newport Beach, Laguna Beach, South County, parents give their kids a lot of money, they give them a lot of freedom. They don't follow up. They don't know what they're doing, they don't know where they're partying, you know, they don't know when they're coming home, they don't know where they're staying the night. When their kids come home, they're not up to see what kind of shape they're in, to ask them a few questions. And so I think a lot of it is that. A lot of with the prescription drug problems, a lot of those prescription drugs are ones the parents are taking that the kids are taking.
You know, I've definitely changed my life for the better. I can't even believe that was me, you know, 2 years ago. Person who was homeless, living in a tent, stealing and going to jail. I thought I was gonna live this life. I thought I was gonna live the life of a drug addict. I thought it was cool. But now I can't imagine that I ever thought of that. It was just absurd to me to think that that's an actual life.
Anyone taking these drugs, prescription drugs, need to be very, very careful, taken within prescribed limits, because they are very, very addictive, and it is difficult to come off of these drugs. And I would advise anyone in that situation to first speak with their medical doctor, get medical advice, and then seek treatment for anything. Especially, you know, if parents are seeing this with their children, do not delay. Get help.
Yes, because I live in Mission Viejo, and you know, I don't know who's gonna watch it, but there's definitely an epidemic in Mission Viejo and the cities that are close by, and it's really, really sad because I participated in that. But you know, there's people who are dying, kids who are younger than me, who are overdosing, and their parents have no idea. Their parents think, oh, they're just smoking weed. It's probably not weed anymore. We
have seen a dramatic rise in our admissions where the primary drug is identified as being opiates, in particular heroin. And over the years, since 2006, it has risen quite a bit.
Don't start. It's not cool. You know, people might be like, oh, why don't you smoke weed? It's cool, it's fine. It's gonna be legal soon. No, it's not worth it. It will just lead to a dark path.
The unfortunate thing about drug addiction is what this young lady said. It becomes the only thing. And even when you talk about the mothers, or talk with mothers who have had children who have died of overdoses, they're appalled because their deceased child's friends come to the funeral under the influence. And we've heard that story. So, and that's just not one story. I mean, that happens, you know, frequently. And so people knowing that you can die and have friends die, or hearing third hand that friends die, are still, you know, addicted. So there's much more that we need to do.
So several years into my being a doctor out in Lake Elsinore, family practice, 6 or 7 years into that, I got trapped on drugs. I was doing a regular family practice. I thought I was smarter than drugs. I could outsmart drugs. I knew how the body worked. I knew the pharmacology of drugs. And things progressed, and I got trapped and almost died a few times.
How long would you say that you were addicted, and how did you get addicted? What prompted that?
Well, it's partly genetics. Maybe 40 to 60% of the reason why people end up like really where they need, to the point where they need to be hospitalized, you know, 40 to 60% of the reason is genetics. You know, not everybody has an ability actually to become addicted. It takes some willpower in a twisted way. It takes persistence, because what you have to be able to do if you're an addict or chemically dependent is you have to be willing to keep taking these chemicals knowing that there's negative consequences to them. Car wrecks and your liver problems and divorces and losing your job, and it doesn't stop you. That's that's about 20% of the world actually biologically is kind of set up to be okay with that. Their attraction to taking a drug and their experience of when they take a drug or a drink is so powerful that they have this potato chip effect, and they're going to take one, they're going to have the rest and more. And negative consequences don't stop you. That's the definition of every patient I've ever treated, and it has nothing to do with how much they're taking or what drug they're taking or how frequently they're taking it, but every one of my patients, they're willing to keep taking a chemical knowing that there's negative consequences. That takes a little bit of genetics to be able to go there. But the other 40 to 60% of the reason why I got into treatment and people get into treatment is you're numbing a lot of emotional baggage too. Anger, guilt, resentment, inferiority, unworthiness, grief, loss, abuse, stress, boredom. Everybody comes in with some genetic load, and some people have more emotional load, but everybody's got both that they got to work on. And sometimes you don't even know what it is emotionally that you're numbing until you get off the drugs. And then there's some kind of painful but healing emotional homework to do.
Let's use you for an example. How many times did you succeed and fail before you evened out and said, that's it?
Yeah, there was about a year and a half of thinking that I had it, and then I had to test it out again. And
so
then
you
getting
tricked
into
yourself.
trouble. Yeah, well, you think that, you know, I was a doctor.
Yeah.
I'm smarter than this, you know?
Of course.
And
I would think that you're smarter than that.
Yeah, I can take drugs and understand, or drink even, and learn how to stop. But there's one of the key principles is learning that you're powerless over alcohol and drugs. And that's a hard thing to admit. You're a man, you're a doctor, you should be able to drink, at least, or stop and start, or like a man should, you know? And it's hard to admit that you're powerless, but basically, if you don't get that, you're probably going to keep testing to try to see who's more powerful. Pretty much every patient I have is trying to prove that they're more powerful than their chemical, and they're all losing really bad.
Have you witnessed a young person overdosing?
Unfortunately, yeah, that's the big change that's happened. I didn't see that very much. Even 15 years ago, didn't see that. But the drugs are so much more potent now. The opiates are so much stronger. People are usually mixing it with a little bit of booze and a little bit of a Xanax. For sure, if you're young and you don't have very much tolerance, you can overdose, and you're not even an addict. That's the other patient population. You know, these people are young and they're just experimenting, which has always happened. But if you experiment with other drugs in the past, they weren't as lethal, you know, and they didn't have the availability now. Large amounts of people coming in, and sometimes it's the first time they ever use. And they were drinking at a party, and somebody said, "Here, take an oxy, and here, take one Xanax," and they just stopped breathing. Right now, in the nation, your chances, and mine, and everybody watching this, your chances of dying of a drug overdose are much more than dying in a car accident.
But you said that it's genetic. When I asked you what caused you to get into it, you said, well, some of it's genetics. But you've gotten off of it.
Right.
So it is very possible to be genetically predisposed to something, to becoming addicted to drugs, but getting off of it.
Oh, absolutely.
Okay.
The tricky thing is you don't want to project that into thinking that, oh, like I or my patients could go back to social drinking or something like that, or a social marijuana or something. You have a perfectly good craving center, a perfectly good mood center, but it takes a little more maintenance. You got to take care of yourself. You got to sleep right and eat right and exercise, you know, just like the normal recommendations. And you got to be careful what you put in your brain, because if you take a little bit of something that maybe isn't even your primary drug, it's going to tweak the craving center for your primary drug. So they all kind of have to go, which is really the whole reward of doing a recovery, is seriously to get to the point where you seriously enjoy not drinking or enjoy not doing drugs. You don't look at people thinking like, I wish I could do that. You're really seriously happy. You're not pretending, you know, you don't feel like you're denying yourself because you want to put a chemical in your brain. You know, you kind of like yourself the way you are.